Today I'm going to start by telling my doctor that I already performed my vital signs, my height, weight, BMI, and a Snellen chart for cranial nerve 2 and your vision. So first I'm going to start by going in the room with my patient. So I'm going to wash my hands, and I'm going to say, hi, my name is Jessica. I'm going to be your student nurse today. So I'm going to provide privacy for you. So I'm going to pull the curtain shut, and I am going to tell you that today we're going to be doing a head-to-toe checkup. So it will be lengthy and require position changes. So all good? Okay, perfect. So first I'm going to look, have you sit up on the exam table, which you're already doing, and I'm going to assess to see that your posture's straight up, not really slouched or anything, and you're good. Okay, so next I'm going to assess your facial expression. So you seem content, pleasant. Facial, not really smiling, just kind of straightforward, and your hygiene is good and speech is clear. Everything's good. Okay, so now I'm going to assess your level of consciousness. So can you tell me your name?
Jacob McKissock.
Date of birth?
December 7th, 1995.
Do you know what today is?
Which is a great question. I don't know what the day is. It is Saturday.
Yes. And where you are?
I am at home.
Okay, good. So level of consciousness is oriented times 4. And now I'm going to start by inspecting your facial structure. So your face is, the shape is round, the configuration is normal cephalic, and your size is normal for your head. So everything's good. And now I'm going to inspect and palpate your hair. So I'm going to say that it's dark brown, the consistency is evenly distributed, and it's soft, and there's no sign of any parasites, lesions, lumps, or redness. So everything's good there. And now I'm going to inspect your face, and there's no lesions, scarring, or any blemishes, so it's good. And now I'm going to palpate your maxillary sinuses and your frontal sinuses. So tell me if you feel any tenderness. No?
No.
Okay, good. So that's all good. And after I palpate that, I'm going to check your TMJ. So I'm going to have you open and close your mouth. Okay, there's no crepiness or clicking. Now move your jaw side to side, like that. Side to side. Range of motion is full. And now I'm going to test for cranial nerve number 5. And so I'm going to have you clench your jaw shut. Okay, good. So everything is good there. So now I'm going to move on to your eyes. So first what I'm going to do is I'm going to inspect them, and I'm going to see that pupils are normal size, shape, regular. Your sclera is white. There's an even distribution of sclera above and below the iris. And there's no abnormalities or drainage. Now I'm going to pull your eyelids down to check your conjunctiva. Okay, it's pink and there's no drainage or any abnormalities there either. So after that, I am going to inspect for your lacrimal ducts. So tell me if there's any tenderness.
Nope.
Okay, good. So after that, I am going to test your pupillary reflexes. So I'm going to shine my light in your eyes. Okay. Oops. I can figure it out. Okay, here we go. So I'm going to come in, and I'm going to do the other side. Okay, pupillary reflex was good. They were even, normal, and the pupillary reflex was direct and consensual, which is good. Okay, and now I'm going to test for your accommodation. So I'm going to come in and out. So follow my finger. Okay, so they were good. So your accommodation is fine. And after that, I'm going to assess for your I'm going to assess for your, I'm going to do full range of motion for your eyes. So I want you to go up, down, side, side, here, 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 here. And those last two tests tested for cranial nerves 3, 4, and 6, which is good. So you're all set there. Okay, now I'm going to move on to your nose. So I'm going to assess for size, shape, and consistency, and the configuration. So everything is good there. And I'm going to palpate. So tell me if there's anything tender. You feel anything? Or is it good?
No.
Okay. Perfect. So now I am going to inspect your nares. So will you push one side and sniff out? And now other So now I'm going to assess the internal nose, and I'm going to use my otoscope. So I'm going to look, or just this. I'm going to look inside. So, not me. Here. Okay, so there's normal mucosal. I can see your septum and the inferior and the medial terminates. So you're good there. Now I am going to I'm going to assess your ears. So moving on to the ears, I am going to inspect your auricle/pinna, your lobule, and your tragus, and everything is normal. There's nothing to worry about. No drainage, size and shape is normal, and let me see if they're equal. Yes, so that's perfect. After that, I am going to palpate the, what's it called? I'm going to palpate your pinna, auricle, mastoid, and your lobule again. So I'm going to palpate. Tell me if there's any tenderness.
No tenderness.
Okay, I'm going to do the other ear. Any tenderness?
Nope.
Okay, so the inspection and palpation on both sides were good. And now what I'm going to do is I'm going to pull your auricle up and back. So I'm going to pull up and back, and I'm going to use my otoscope. So I'm going to use this right here as my otoscope. And I'm going to look inside. I'm going to see that there is no abnormal drainage. There's no lesions, masses, anything wrong with it. I'm going to do the same up and back for this ear. Okay, now I'm going to go in further, and I'm going to look at the tympanic membrane, and the outer external ear was pink. So now I'm going to do it internally, so I'm going to go in deeper, and I'm going to see that it is a pearly white color, and the cone of light is at 7 o'clock, which is normal. And I'm going to do this side also, up and back. Okay, it's pearly white, and there is a cone of light at 7 o'clock. And I can see your tiny little bones in your ear, which is also good. So after that, I'm going to perform a whisper test. So I'm going to say a 2-syllable word, and if you can hear it, repeat it back for me. Good.
Pancakes.
Okay, so you got that right. And now I'm going to move on to assessing your mouth. So I'm going to look at your lips, and your lips are pink. So can I have you smile now? Okay, so teeth are in good repair, they're white, and there's no dental carriers. Okay, can you lift your gums for me, or lift your lips for me so I can look at your gums? Okay, so gums are pink, there's no lesions or anything. And next, I'm gonna have you open your mouth, and what I would do is I would palpate his tongue. Okay, you can close it now, sorry. I would palpate his tongue, but I don't have gloves on. So I would be assessing for nodules and or just any tenderness or anything. So can't do that right now, but now I'm going to have you open your mouth again, and I'm going to assess for tongue strength. So can you just move your tongue around? Okay, tongue is good, and now I'm going to look for the hard and soft palate. It's good, and now I'm going to have you stick your tongue out and say ah. Okay, you can close your mouth for a second. Okay, so his uvula did rise, and it's midline, so that's good. And now I'm going to assess your tonsils back here. So can you open again? Okay, his tonsils are great too because they're not super hidden, they're just out a tiny bit, but there's no obstruction or anything. And this would be a perfect time, I'm not gonna do it, but I would test for his gag reflex, which is cranial nerve 10, but I'm not gonna do that to him. So that's everything for the mouth. So now I'm gonna move on to the neck. So for the neck, what I'm gonna start out by doing is I'm gonna assess your neck. I'm going to see that the thyroid is not present. There's no abnormal pulsations or anything. It's midline to the rest of your body and normal size and shape, no lesions or anything. Now I'm going to palpate your trachea to make sure that it's midline. Okay, it's midline, so we're good on that. And then I'm going to touch all of your lymph nodes to check to make sure that they're good. So I'm going to start with pre-auricle and tell me if there's any tenderness. Post-auricle. Tonsillary, submandibular, submental.
No.
Okay, now I'm going to do anterior cervical, posterior cervical. I'm going to hit the occipital back here, and then I'm going to check supraclavicle. Any tenderness?
Nope.
Okay, good. So did all the lymph nodes. Now I'm going to move on to your and your upper extremities. So now I'm going to do your upper extremities. So I'm going to feel your arms. So I'm just going to hold right here. I'm going to feel all of them down. Okay, let me feel this. Okay, so the skin is warm. The skin tone is tan, normal color for his body. Size is normal, and there is no masses, lesions, or anything. Temperature's warm, skin is moist. So we're good there. And now I am going to assess your, I'm going to touch your, I'm going to check your your brachial pulse. So I'm going to check here. Okay, so that's normal. Normal, and they're 2+ pulses. And now can I have you extend both wrists? Okay, I'm going to check both your radial pulses at once. Okay. Radial pulses are equal, and all of those pulses were 2+, so we were good there. Now I'm going to assess and palpate your shoulders, elbows, wrists. Okay, there's no crepitus, edema, or any lesions or lumps there, so we're good. And now I'm going to have you assess your range of motion for everything.
Okay.
So can you lift your elbows like this? Okay, can you stick them out to the side? Okay, good. And now, can you stand up for me for this one? Sorry, so put your arms, hyperextend them, now bring them forward. Now internal, external rotation, and now circumduction, so right here. Okay, so that's all good. You can sit back down. And now I'm going to have you shrug your shoulders for cranial nerve number, yes, like this, cranial nerve number 11. Okay, that's good. And now I am going to do all that. Also, earlier, I need to check your hands. So your reflexes on your hands. So flip them, or like this, and now do this. Okay, and earlier, I forgot this, but so I need to assess the range of motion for your neck. So I need to do it with and without tension. So can you look down first? And now back, side, side. And now try sticking your ear to your nose. This, and then like this. Okay, and I'm going to do it with tension. So side, face your, okay, good. Now the other way. And now push down against my hand. And now push back against my hand. Okay, and that's good. All right, so now I'm going to move on to the, your posterior thorax. So here, I'm going to have you, can you sit on the ledge of this arm right here? Sorry, just so they can see. Okay, so first I'm going to start by stating that I inspected and palpated the posterior thorax, and there was nothing wrong, no lesions, masses, lumps, everything was good. Okay, so next I'm going to auscultate with my diaphragm all 18 to 20 spots, and I'm going to listen for any abnormal sounds. Okay, so breathe in and out for everything I do, or every time I place your steps. Good. Breathe in. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. Okay, so everything was good there. Now I am going to have you turn around to the front, and I'm going to state that I already inspected and palpated the anterior thorax. So next I'm going to auscultate for all 10 sounds. Okay, so breathe in and out every time again. So breathe in and out. 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, everything's good there. So that's the anterior and posterior thorax. So now I'm going to move on to your precardial heart. Okay, precordial heart. Okay, so will you sit back down for me? Okay, so I'm gonna lean this back. Okay, just for a little bit. So first I'm gonna state that I inspected his jugular vein and there were no abnormal pulsations, and I inspected and auscultated your carotid arteries and everything was good there, and 2 pulses. Okay, so moving on, I also listened to all of his heart sounds. Everything was normal, no bruise or anything, and then I also listened to his apical pulse, and everything was good. So now I'm going to move on to your abdomen. Okay, so first I am going to inspect it. Everything is normal, contours fine, configuration, size, shape, no lesions, and then next I'm going to listen, auscultate for vowel sounds. So I'm going to do it in all 4 quadrants. I'm doing it with the diaphragm, sorry if it's cold. Okay. Okay, and there are about 5 vowel sounds a minute, which is normal and healthy, which means it's normal active. Okay, so after that, I'm going to palpate it and let me know if you have any tenderness. So I'm going to do it lightly and deeply. So first I'm going to start with light. Start on the right side. Any tenderness? Okay, I'm going to do deeper. Good? Okay, sweet. So now I'm going to move on to your legs. So I'm going to move these up a tiny bit. So I'm going to palpate the legs. I'm going to come here. Okay, so there's no crepitus, tenderness, swelling, or there was no tenderness, right? Okay.
Yes, no, there was no
Okay,
tenderness.
good. So no lesions, lumps, everything looks normal. Contour, skin is warm, and there's no crepitus, like I said. Smooth, moist, and now I am going to assess your popliteal pulse, and I have to do these one at a time. Okay, so let's move that. Found that one that's good. Okay, that one's good. And now I'm going to do your dorsalis pedis. Okay, and those are symmetrical, and your posterior tibial. And those are good. Now I'm going to assess your hips. I'm going to palpate right here. Okay, you're good. Your knees, and your ankles, and your toes. Okay, also I actually need you to take your socks off because I need to check capillary refill. I just do 1 toe.
Okay.
Okay, so I'm going to go here. Okay, capillary refill was less than 2 seconds. And I'm going to check your nails too just to be safe on your hands.
Oh.
Sorry. Okay, capillary refill was good there too because it's less than 2 seconds. So you can put your sock back on if you want to, or you can just leave it off. Okay. So after that, I am going to assess his deep tendon reflex. So it might be hard here because your legs are long.
Okay.
You'll have to put that down. Okay, can you try to sit back as far as you can so it's not like, thanks. Okay, I may not be able to get with my stethoscope, but we'll try. Okay. Reflexes are good, so that's awesome. And I would state that I assessed for full range of motion of your hips, knees, ankles, and toes. So now I'm going to have you stand up. So first I'm going to have you bend over and touch your toes. Okay, so that's good. I'm going to assess that you can stand back up now. His spine curvature is normal, nothing wrong. And now I'm going to inspect, and I'm going to see that his vertebral column is normal, and so is his paravertebral muscles are good. And I'm going to stand here and look, and I'm going to see that there's no scoliosis, and there's a normal S curvature. So now I'm going to have you walk straight and then come back. Okay, now come back to me. Okay, gait is good. And now can I have you walk heel to toe like this for your tandem test? Okay, you're good. And now I'm going to have you do this thing called the Romberg test. So I'm going to have you stand up straight, and I'm going to have you keep your hands at your side and close your eyes. And I'm going to have you stand up for 60 seconds. We've got about like 15 seconds left. Okay, you can open your eyes. His Romberg test was negative because he had minimal swaying and he wasn't stepping out to recorrect his balance. And now I'm going to have you close your eyes and have your arms out, and I'm going to have you touch your finger to your nose. So
Okay.
close your eyes and finger to nose. And now other arm. Okay, and that's his head to toe check off, and he was good. So good job.